And I would kind of move over to Dr. Raj and talk about uh, the role of cybersecurity here and what do we need to do. So, if you look at July 2020, US and UK actually accused a major superpower of trying to steal their vaccine research. And in November 2020, last year, one of Russia's vaccine manufacturing facilities was actually under cyber attack. So taking these instances forward and what Michael actually alluded to, right? What is the level of cyber security is required, and is there a role for somebody like WHO to play in it, Dr. Raj?
Thank you. Thank you, Sanjay, for this question. This is a very important issue and a very important question that we must address globally and also locally at the national level. There are three areas where the bridge can happen. The first area is about the counterfeit vaccines that we just heard of, which primarily at the level of the Gavi and the COVAX and the WHO at the global level, where there are these vaccine large distribution plans being made. There, one sort of checkpoint needs to be there. But more importantly, I think it is about the regulatory systems within individual countries which need to really step up in order to address this issue. For example, in case of India, the Drug Controller General of India has already mentioned that they have processes in place in order to address this issue about the counterfeit vaccines. The third area where it might happen is a cybersecurity bridge might happen is around the data, which is happening at the level of the programs. And in India, as we know, there is a committee which has been formed under the leadership of Mr. R.S. Sharma, who is one of the best brains in India around digital security. Therefore, I think the countries have all stepped up. And particularly from India's aspect, I can say that India is very much geared up in terms of addressing any cybersecurity breach that might happen. A key point that we must remember is the issue about pharmacovigilance, about vaccine safety. That is prime importance in case of vaccines. And in India, the pharmacovigilance activity is very high and of a very high standard. WHO had very recently assessed the pharmacovigilance activity in India about 2 years back, and they had given a very high rating to the Drug Controller General of India. So in short, I will say that the countries have really geared up in our regional discussions that we have with WHO, UNICEF, and the different banks. This is a topic that we discuss. We know that the countries have stepped up. Not everything is publicly being discussed because obviously the strategies cannot be discussed publicly. But I would say that in terms of Gavi, in terms of the countries, they have really stepped up. Whether WHO has a role, that goes without question. WHO definitely has a role. WHO has a regulatory role in its premise of activities. Therefore, I would say yes, WHO does have a role.
Thank you, Dr. Raj. And so good to know that from a pharmacovigilance, India is very much secured and we are able to manage the cybersecurity. So happy to know that. Thanks a lot.